Welcome back to another episode of Halle City Podcast. Today, I'm very lucky to have Dr. Nooren coming to introduce herself, to tell us a bit about what she's doing in Mediclinic.
Thanks so much for having me. I'm Nooren Joosub. I'm a consultant dermatologist working at Mediclinic City Hospital. I'm also at Dubai Mall and Creek Harbour. Been a consultant dermatologist in South Africa for many years and then recently moved over to Dubai last year.
Well, I've got to visit South Africa. It's the mothership of Mediclinic, and as I heard, the weather's good and the people are amazing.
Yes, I'll vouch for that.
So we're talking about skincare today, and we're talking pregnancy, and we're talking about all different things and subject that's quite close to your heart, clearly. What ingredients in skincare are good or safe during pregnancy?
So this is a good question because it starts off the whole topic. And what we have to understand is clinical studies on pregnant women are very few and far between, because first and foremost, no one's going to investigate a pregnant woman or give them something that could be toxic to the baby. So a lot of what we are basing our theories on is kind of more of a hypothesis, unless there has been a medication that we have shown effects on the baby. So a lot of ingredients, I like to always say, is keep your ingredients very simple and very neutral, especially in the first trimester when the baby is being formed. Thereafter, yes, there's talk of adding in a bit of salicylic acid and benzoyl peroxide, but I will say the pharmaceutical companies do not advocate any of these, and no one's really going to say use an active ingredient during pregnancy.
Obviously, it's a very sensitive time during pregnancy, and a lot of women suffer from acne or hyperpigmentation. Sorry, I'm struggling with my words today. What would you recommend there?
So acne is a tough one because we have to always, often if it's scarring and debilitating for a woman, there are a couple of things that we can do, but again, not in the first trimester and maybe in the second trimester. And you've got to go and see your dermatologist because we do have 1 or 2 antibiotics that we can use, 1 or 2 topical agents that we can use that are safe. But essentially, we want to, again, wash the face, moisturize if you need to, and kind of keep it as clean as possible. Hyperpigmentation is increased in pregnancy because we stimulate melanocyte-stimulating hormones. So literally, there's a lot of pigmentation going on. And your simplest thing is sun protection because that will already start reducing your effects from the UV rays.
So what medications would you, or things not advocate for, what would you avoid during pregnancy?
Well, absolutely. In terms of, say, for example, acne medications, many antibiotics, retinoids are really, really a no-go, can't go anywhere near them. And that's why it becomes such a challenge to treat pregnant women because we often have to wait for the baby to come out before we can do something.
Next question, I think a lot of women are going to want to know about stretch marks. Right. Obviously, it's a concern. Obviously, before getting pregnant, a lot of women obviously take care of their body and want to always look amazing. So how do you approach that subject and what would you recommend?
So if you are planning a pregnancy, the most important thing to understand is stretch marks are formed by the shearing forces of elastic fibers. So always moisturize your skin. And it sounds simple, but it actually can be done as a preventative measure before pregnancy also. And make sure your moisturizer is fragrance-free, has emollient, occlusive, and humectant properties. So it really, really moisturizes the skin. But then again, if your mom had stretch marks, you will probably have stretch marks. So you also have to accept that there is a genetic aspect. And as much as you keep hydrated and moisturized, sometimes that can still happen.
And what about alternative therapies such as massage and things like that? Does that sort of help?
So it depends in the area that you're massaging, because your OBGYN will definitely not want you to massage the tummy area, which is where most of the
main stretch marks come from. Yeah,
absolutely. So I think you're going to have to be very, very cautious in that way. And the skin is stretching, you are growing. It is one of those things that it's going to may happen.
And foods or anything like that, nothing's really, as you said, more genetic.
But stay hydrated. Hydrated.
Especially here in the Middle East, obviously it's very hot. So what do you recommend sort of drinking for sort of?
So basically, it's your general sort of 2 liters of water every day. But remember, if you are sweating and it's summertime, you've got to replenish for that. So make sure then it's a bit more.
You said about sun protection. Yes. So what sort of, obviously when you go to the supermarket, they see so many sun protections. I get confused. And I suppose if you're pregnant, you want to get the right thing. You don't want to do any harm to your child. So what do you recommend?
So with pregnant sunscreens, there's 2 groups. One is actually go for a kiddie-friendly sunscreen because they tend to find that the chemicals and the ingredients are a lot less toxic. So that's a good one to go for. The second one is a mineral sunscreen. So something that has a mechanical blocker, like a zinc oxide or a physical blocker that blocks out those UV rays. So it's not chemically absorbed into the skin to alter anything. So kiddie sunscreen or a mineral sunscreen.
And how does pregnancy change your skin anyway? Are you going through, obviously you're going through a body process anyway during pregnancy, but how does that pregnancy really relate and affect the skin?
Your skin is definitely going to become more sensitive. And the reason is because eczema is one of your most common skin manifestations of pregnancy. So that's why also in terms of products, you've got to keep it fragrance-free, very simple cleansers, simple moisturizers. Also, as I said again, you're going to have pigmentation, so you have to avoid the sun. A good active sun protection program, reapplying your sunscreen. Those are the 2 biggest ways that pregnancy affects the skin.
As a dermatologist, you see so much research and you see everything that's coming on the market. What natural remedies would you recommend to our viewers? Because obviously natural is obviously best most of the time, but
natural is best. But what one defines as natural could mean different things for. When you look at it, there's been so much talk about coconut oils and these oils and that oil. So the biggest issue we have with oils on the skin is, like I had said to you before, a moisturizer has to have something that is a humectant, so attracts water into the skin. It's emollient, so it fills in the gaps between the cells to make it supple, and something occlusive that's a barrier to trap in the moisture. A lot of the oils are only occlusive, so they only trap in moisture, but there's no moisture going into the skin. So I know there has been a lot of talk about coconut oil, but unless you're adding a moisturizer in underneath, we do have issues with only oil. Also, with hormonal changes in pregnancy, if you are going to have acne, then something natural like coconut oil isn't great because it is comedogenic and it does block up the pores. So I will say healthy diet, sunscreen, sleep well.
So where can patients book in to see you?
So we have a nice, on the Mediclinic website, we have a nice OK Doc little icon, and you just click on my name and you'll choose your facility that you're closest to. So like I said, City Hospital, Dubai Mall or Creek Harbour, and it's very easy. Click, 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 and you'll make the appointment with me.
And what's your take-home message to ladies out there?
I know that it's very challenging, the skin changes in pregnancy, and I know sometimes it's hard emotionally to deal with the body changes, but just focus on baby first, and we usually can sort out all the problems when baby's out.
Thank you so much for your time today. I really enjoyed listening to some of your answers, and I should imagine it's answered a lot of questions for the ladies out there. Thank you for joining Hyperpigmentation Podcast, and we see you next time.